Hello everyone. Today we are going to talk about knee replacement and what care you need to take before going for surgery and after you're done with surgery. This is an X-ray which shows a patient who needs a knee replacement. You can see this is the inner side of the knee and this is the outer side, and you can see that there is hardly any gap left and the bone is rubbing against each other. So ideally we advise patients before going in for surgery to have a good balanced diet so that their immunity is not too low. They have something good in proteins. They do good physiotherapy so that they are well acquainted to know what exercises they'll need to do even after surgery. Doing a pre-op physiotherapy helps them to build their muscles, make the muscles a little better, because usually because of the pain and because of not much use, the muscles become very weak and then they take a longer time to recover. So doing a pre-op physio is very important. So once the surgery is done, and that this X-ray shows how the knee will look after surgery. You can see there is an implant here on your thigh bone, that's the femur, and also on the tibia, that's your leg bone, and you can see there's a gap in between because that's the plastic in between. So once you're done with your surgery, of course there are many precautions which you need to take for a few days at least, which include, you need to do good exercises as per your physio and as per whatever your surgeon says. So we have a fixed protocol, and we usually give our patients a booklet which tells them which exercise is to be done on which day and how many repetitions. And there's also a VAS score on the booklet where you can measure your pain and mark it accordingly, so you can know whether your pain is reducing, and even your physio and the surgeon can keep a track about your recovery. Second, you need to do icing at least 2 to 3 times a day. You need to apply ice on your knee so that helps reduce your pain, that helps reduce the swelling and the inflammation. Third, you shouldn't be in one position for too long because your knee is recently operated, it is swollen, so it becomes very stiff very fast. So if you are in one position for too long, your knee will become stiff and you will get pain. So it is good that you keep moving around, at least bend your knee, straighten your knee, if possible move around in your house, and don't be in one position for too long. And the other thing which you need to avoid is you should avoid sitting on low sittings like a sofa or a low chair completely for the first few months after surgery, because when you're getting up from a low sitting, you give too much stress on your knees, and that may cause pain and make you more uncomfortable. And lastly, when you're using your toilet, maybe you will have to use a commode extension to increase the height of your commode so that it will be comfortable for you to sit and get up from the commode. So these are the few post-op cares, the care which you need to take after surgery. And you will be recommended some kind of a walking aid also, like a walking tripod stick for a few days till you gain good balance. Once you have got good balance and good strength in your muscles, you wouldn't need any kind of a walking aid. You will be able to walk completely independently. So these are the few main precautions which you need to take before and after surgery. Of course, your diet has to be good. It has to be a balanced diet which will give you good nutrition, which will help speed up your recovery.